Have you noticed that your PMS seems worse now than it did in your 20s or your 30s? Maybe you're feeling more irritable, more emotional, more anxious. Your periods haven't stopped yet, but suddenly your hormones feel unpredictable. One month you're fine, the next month you're wondering what's happening to you. If this sounds familiar, you're not imagining it. Many women notice significant changes in their PMS symptoms during their 40s. And today I'd like to explain why this happens and what may be going on beneath the surface. Hello, I'm Madhvi Naik, a classical homeopath. In this video, we are going to talk about why PMS often becomes more intense after age 40, how perimenopause affects your hormones, and why understanding your individual symptom pattern matters. Many women assume that hormonal problems begin when period stops. But for most women, the hormonal transition actually begins years earlier. This stage is called perimenopause. During perimenopause, hormone levels don't simply decline. Instead, they fluctuate, sometimes significantly. Estrogen may be higher one month and lower the next. Progesterone often begins declining earlier than and more consistently. As a result, women notice symptoms becoming less predictable. PMS that was once mild may become more intense. Mood swings may feel stronger. Sleep may become more disrupted. And emotional resilience may sometimes seem lower than it used to be. One of the most common changes women report is increased irritability. Things that never bothered you before suddenly feel overwhelming. You may feel less patient, more reactive, more easily frustrated. Sometimes women tell me, I don't even recognize myself. This can be particularly noticeable 1 week before period begins. Another pattern is anxiety. You may notice racing thoughts, feeling on the edge, difficulty relaxing, a sense of dread or overwhelm that appears predictably before your period and then improves once bleeding begins. Many women are surprised to discover that their anxiety has strong hormonal component. Many women in their 40s are also juggling multiple responsibilities. Careers, children, teenagers, aging parents, household responsibilities. Years of chronic stress can begin catching up with the body. As hormone fluctuations increase, women often notice deeper fatigue, poor recovery, feeling depleted even after rest, and PMS symptoms may become more intense when nervous system is already overwhelmed. Sleep is another area that often changes. You may feel asleep normally but awake at 2 or 3 in the morning. You may wake feeling unrefreshed, or you may feel exhausted but unable to fully relax. Poor sleep can make PMS symptoms feel even worse because body has less opportunity to recover. One woman may become angry before her period, another becomes anxious, another becomes weepy and emotional, another experiences headaches, bloating, breast tenderness, or intense fatigue. There is one reason an individualized approach is so important. Even though the diagnosis may be PMS, the way it shows up is unique for each woman. The symptom pattern matters, the emotional changes matter, the triggers matter, and understanding those details can provide important clues about what support may be needed. In homeopathy, we look beyond the label of PMS. We want to understand the entire picture, how your symptoms change throughout the cycle, how stress affects you, how your sleep is affected, how your energy changes, how your emotions shift. Because every woman experiences hormonal transition differently. An individualized treatment begins with understanding that unique pattern. If your PMS seems worse after 40, please know that you're not alone. Many women experiencing significant hormonal changes during perimenopause long before their periods stop. Your symptoms are not all in your head, and they are not something you simply have to suffer through. Your body is communicating something important, and understanding those signals can sometimes be first step towards feeling more balanced and supported. I'd love to hear from you. Have you noticed your PMS changing after 40? What symptoms has become more noticeable to you? Let me know in the comments below. If you'd like more personalized support, you're welcome to explore working with me and learn more about my Whole Woman Hormone Reset program. And if you'd like more videos on hormones, perimenopause, burnout, stress, and homeopathy, be sure to subscribe to my channel. Thank you for watching, and I'll see you in the next video.